Hi, welcome to Tea Time. I'm Ashley Adamson. This is unedited, it's unscripted. We do the real here, and today we're talking about everything that I've learned from researching about hormones and also taking hormones for about 2.5 years now. So this was a request from Joanna. Thanks, Joanna, for making the request, and thanks y'all for also saying that you wanted to hear it. So here it is. Yeah, so there's a lot to talk about here, and I'll just set a preface with saying that I'm not a doctor, and I've done my research. I have talked to many doctors, so I have some information, but I think that this is a really good starting point for then looking for other places. And so at the end of the video, I'll also talk about resources where you can do your own research, because you should not be taking my medical advice. You should be doing your own research and making your own decisions. This is kind of it's a broad field that is very much on the edge. I feel like I'm in some kind of futuristic world now where people can change their genders by taking chemicals. It's pretty amazing. But because of the futuristic transition of being trans medically, it also means that there's a lot of new stuff going on, and there's old stuff, and there's traditional stuff, and there's just a lot of things that are not known as well. So there's risks, and that's probably one of the other scary sides of transitioning, right? When, I don't know if you've transitioned, but if you're taking hormones or you were thinking of taking hormones, how frightening was it to think about these long-term risk consequences? For me, I was so scared about being medicalized. I didn't take any kind of pharmaceuticals at all on a daily basis, and suddenly I'm taking this pill every day, and I'm taking this other pill, and it's starting to dehydrate me, et cetera, and that gets kind of frightening because you're thinking about your long-term health. But what's the value of long-term health if you don't even make it that far? A lot of people, they don't think they'll be able to stick around if they don't transition. So yeah, there's different reasons for whatever reason you're interested in taking it or you are taking it. And we had an interesting discussion, I think, yesterday in yesterday's tea time. So today we're talking about the medical side of things. So from a meta perspective, let's cover that. And I'm going to use my phone because I have some notes here. But from a meta perspective, basically this is what happens when you do male to female hormones. You basically need to get your estrogen levels readily absorbed into the body, so that way it can communicate to your pineal gland, which is right in the center of your head, to communicate to the rest of your body that you're a female now. The pineal gland, did I say pituitary? I'm not sure. It's the pineal gland. The pineal gland communicates to the rest of your body to grow boobs, where to put fat, all of these things. And so once there is estrogen instead of testosterone, your pineal gland goes, oh, okay, this is a female, so let me send all the female signals. Now there's a whole list of feminizing traits, and I'll just cover them very briefly. When you do MTF hormones, which is you get fat movement, so you get fat moving to your boobs, they become more sensitive. You get fat moving to your hips, your fat around your face shifts, and yeah, you experience other things maybe even feeling like you're on some kind of emotional cycle. I get into that in some other videos, so I won't dive too far, but those are some things. And in order to kind of get to this space where your pineal gland is going to communicate to the body that it's a female, you need to block your testosterone. So you take a testosterone blocker. Typically in America, they often prescribe spirulactone. But spirulactone makes you more dehydrated because it makes it harder for you to absorb water, so you need to drink more water. Yeah, there's people that really don't like it. But basically you need some form of way to stop your testosterone from being generated. One of those solutions is an orchiectomy, which is you remove the testes, and now it's there's definitely no testosterone being produced except by the little bit that's being produced by your liver. And that's okay, because you want a little bit of testosterone, especially if you want to engage sexually. A little bit of testosterone makes you horny and gives you the ability to be aroused, all of that stuff. So yeah, so let's talk a little bit about some of the things that I've researched, and I've covered a wide spectrum, spent many hours doing this, so hopefully this saves you time in knowing where to look and what to look at and what to look out for. So probably the biggest, most important thing that I learned, which is from this doctor called Willpowers, who has this method that people call the Willpowers Method. There's sort of like, in the online sphere, my impression is there's two worldviews of like transgender healthcare that are dominant, which is the WHO, World Health Organization protocol for doing trans healthcare, and that's being pioneered mostly at the San Francisco, I think UCSF. They have a program there where they're kind of pioneering those standards. And those are sort of like the gold standard that most doctors will follow and refer to, especially if they're less experienced or less comfortable. Following the WHO standards is great. But there's, a lot more things you can do, and you can be a little bit more cutting edge with things. So Willpowers is on the other side of things, where he's more on the edge of science and figuring out things and running these consenting experiments with these trans women in figuring out what works best for them. And he has a whole presentation, which I'll link in the video below, that you should check out because it'll blow your mind. The Tldr, which is too long didn't read, you didn't see it, is the most important thing to understand is there's estrone and there's estrogen, and that's E1 and E2. And E1 is a weaker form of estrogen, and estrogen and E1, I'm just going to refer to E1 and E2. E1 and E2 have a ratio in your body, and based on that ratio, it affects how feminized you get affected by your hormones. Now, if your E1 is way too high, then it means that you won't really get the feminizing effects that you want, such as boob growth or as much fat redistribution, because those levels are too high. And the easiest way to get those levels too high is to just swallow the estradiol pill that you're given, because it goes into your liver, and then in your liver it produces a very high amount of estrone. I don't know how it works with patches, but I don't think it's the same way, because it's going through your skin, which means it's going more into your bloodstream rather than being absorbed in your liver. So one of the recommendations to start with is from the Willpowers framework is that you do it sublingually or subcutaneously, or sublingually or buccally, sorry. Buccally means you take it and you put it underneath your gum here and you let it absorb, or you put it underneath your tongue. He recommends doing this for the first year to get your estrogen levels in the right place, and then moving over to injections. And I followed this method, and I sort of followed this method. I switched to injections a little sooner, but switching to injections was a great move, and I'll explain that in just a second. But I want to get through this absorption phase, which is that by absorbing it through your gums or through underneath your tongue, you're bypassing the liver absorption, which then means that your estrogen levels don't spike as much, your E1. But if you do it under your tongue, what I found is that it kind of just starts to gather underneath your tongue, and then you subconsciously start to swallow it because you just have all this liquid gathering in your mouth. So the best way that I found is to put it under your tongue and forget about it and just leave it there for an hour till it kind of dissipates. But yeah, I got really tired of that method. And and the T blocker. So T blockers such as spirulactone, those things, I think I mentioned that. But yeah, you normally take a T blocker with your estradiol, because estradiol alone will not be able to block the estrogen or block the testosterone that you have running through your body. So you need something to hold it back. Yeah, so injections. So injections were game-changing for my body transformation, and I've told friends about this whole E1, E2 thing, and they switched to injections, and my friend who I was dating, actually, she just grew huge boobs and got super feminized all of a sudden, and she was 6 months ahead of me, and it was her body was just ready to go. When she was 2 years in, and she switched to injections. It was very feminizing for her. So obviously that worked great. So estradiol valeriate is the common one that is prescribed, and you can get this in the United States. In Europe, it depends on which country you're in. I'm in Germany, and I actually can't get that, so I'm figuring out what happens once I run out of my stockpile right now. And Typically, it's recommended to inject that every 5 days. And now I'm using a different resource, which I'll mention, which is Lena's group called MTF. It's called the MTF group, super plain, but it's basically comprised of a lot of like trans chemists, scientists, and people who are science-minded. And it's by far the most in-depth, cutting-edge research around medicalization of trans women that I've ever seen. It's a very small group, but it's like you can post any question there and you'll get like almost like a doctor level response with the amount of research. So I'll also post that link there. I highly recommend checking that group out and reading through things. Today they had a discussion around some of the new stuff that Willpowers published about SHGB levels and the relationship between that and desirable estradiol levels. Something that I can't really get into, but the TLDRs, there's a lot of good stuff there. Anyways, what Lena recommends, who runs that group, is like do it every 5 days rather than every 7 days. I personally do it every 7 days to do an estradiol injection. And that's because I'm lazy and I prefer to just do 7 days and I don't see much of a difference. The big difference that I found with injections is that, first of all, injections bypass your liver and you don't have to absorb it and like let the pill hang around forever. So that's great. You do it once a week. And then on top of that, it is healthier for you because taking it through the pill can increase your chances of getting, here we go, venous thrombosis, which is a blood clot that can happen in your leg. And then if it gets in your leg, then it can also like get loose and then go into your heart and cause a heart attack, which is kind of like, you know, it's a small risk, honestly, but it's an increased risk from taking estradiol, estrogen as a pill. So taking it as an injection reduces that risk completely. And additionally, it's so powerful that it acts as a T blocker. So I don't need to take a testosterone blocker anymore, which has its own side effects. So I don't need to take Spiro, which is great. On the note of health, I've recently found out about kidney stones. That's a thing with trans women. You have to be careful about your calcium levels and your oxalates because that can actually help create kidney stones. And I guess we're more prone to them. You can read up more on this in Lena's group. There's more information there. Yeah. Oh, and the last thing with injections, subcutaneous versus muscular. So you can do intramuscular, which is basically you take the muscle and then you inject it, or you can do subcutaneously, which is where I don't have a lot of fat here, I'm sorry, but you try to take the fat and you inject it into the fat. Now you do this in your leg, and I can't lift my, well, fine, I'm gonna lift up my leg. Okay, so this is where I inject, and let me see if I can, oh my God. Okay, so this is where I inject right here. And, oh, there's my, so if I do it intramuscularly, that means the needle goes straight into my muscle and then it injects, it stores the estrogen there. The problem with that is that if I use my legs like I do glute exercises, it means it squishes the estrogen and then the estrogen just gets distributed through my body a lot faster, which gives you a larger spike and gives you more uneven flow of your estrogen in your body. So what I try to do is do it subcutaneously, which is to take some fat, I got some fat here, and to put the needle in sideways and insert it into the fat section. What that means is, even if I'm using my muscles, it's still safe in the fat, and that gives me a longer, more even tone of getting estradiol going into my body, which has actually resulted in a spurt of boob growth recently, which I changed it to recently, so I'm very happy about that. Yeah, okay, so that's that. Health risks. We covered venous thrombosis, kidney stones. Okay, good. And then, oh yeah, so you want to use bioidentical estrogen. There are some estrogens that you can get that are like patches that are like artificial estrogen, not bioidentical. And you want to avoid those because there's more health risks involved. As far as like breast growth, this is a little different, but as far as breast growth goes, it's based on your IGF-1 levels. Your, I'm forgetting what it stands for. I think it's your growth hormone factor. And so you want to make sure that you're supporting that. And it's alleged, so this is a little skeptical, but I don't see any problem in taking vitamin D. Vitamin D is supposed to help with growth, so I take vitamin D. There's other supplements that you can take that also might help if your levels are low, like zinc. I take zinc anyways because it helps with the immune system. Also, on the topic of supplements, I recommend taking magnesium, a magnesium supplement as well, just for your muscles. And then, yeah, so resources. This is the end of the video. The resources that I highly recommend checking out is the World Health Organization Trans Guideline, the Willpowers Method, which I mentioned, and then MTF HRT group run by Lena. And then for those that don't know how to get access to hormones and you're in the United States, I highly suggest checking out Spectrum Health, which I'll post also when I was working at Trans Lifeline. This was one of the organizations that I would recommend to people because you can get prescription online and you don't have to go to any pharmacy. You don't have to be blocked by a doctor in some state that just doesn't understand your trans healthcare. So I hope that was helpful. Hit me up in the comments below if you have a suggested topic. Today this was Joanna's topic. Thank you, Joanna, for suggesting it. And like and subscribe, hit that bell icon, get a notification when I come out with the next one, and I'll see you tomorrow. So from Berlin, tschüss, bye.